Hello, VIPers, and welcome to a coronavirus update, Thirsty Thursday. We're glad you're with us this evening. As you can see, I'm coming to you live from my viral free zone, better known as my backyard. It just was so pretty outside, and I wanted to emphasize the fact that oftentimes being outside right now is the best place you can be, especially if you're keeping social distance from your puppies and your chickens and your goats and whatever else you may have outside. So since I'm outside and since this is truly live, you may hear some of my neighbors' annoying dogs. You're not going to hear my dog because he's well behaved, but you may hear some annoying neighbors' dogs. So I want to take a moment to, it just adds to the environment, right? It just makes the ambiance a little bit more realistic. Hopefully we won't have a whole lot of ambulances and that kind of thing. But I wanted to take just a minute to update you on what we're doing in our office over the next few weeks. If you're not a patient in our practice, this won't apply to you, but you should be. Come on, what are you doing out there going to some other... No, I'm just kidding. We actually have a whole bunch of new members, and actually we've got a lot of folks, members of the WOW community now that are from all over the country, in fact all over the world now. So we're really excited for you guys. Sorry you can't come see us as patients, but we get that. Just an update for those who are a patient in Women's Health of Augusta. Starting Monday, we're going to be limiting our office hours to seeing just our obstetrical patients. So if you're an OB patient, we're going to reschedule you for the morning hours. If you're a GYN patient, which all of mine are, then if you're just for a routine checkup and are not having any problems, we're going to reschedule you, mainly for your protection, mainly to make sure that you don't get exposed. We want to do our bit for social distancing. I mean, we're all in this together, right? We're all doing this for the same reason. So we wanted to do our part and make sure that we weren't being hypocritical about telling people to social distance and then having everybody coming into the office, especially just for routine checks. So for the next 2 weeks, that's just 2 weeks only, and hopefully by then a lot of this will have subsided. But for the next 2 weeks, if you have a routine checkup in our office, we're going to reschedule you. Now, obviously, if you're having problems, we want to see you, but we're also instituting something that's pretty unique, and that's the opportunity for virtual visits, telemedicine visits. I kind of pioneered this, quite honestly, in this area a year or two ago, being able to have these visits. We started out with our weight loss program in seeing some people virtually. Well, this has obviously become a huge issue now in face of this COVID-19 epidemic. So if you are having a problem that needs to be addressed but doesn't necessarily need a physical exam, then we can accommodate you during these next 2 weeks, and actually during Masters Week, which now we've had to reschedule, as many of you know. And it's just a simple matter of going to the link that I'm going to put up right above this video, and you can actually pick a time to do your virtual visit. And we can take care of a tremendous number of problems with that, whether it's menopause, hormone-related problems, whether it's mood and emotional issues, stress issues, refill medications. We can also screen people and help them understand if they need to be seen, if they're worried about COVID-19, and we'll talk about some of those issues in just a moment. But that's a great tool. We don't want you coming in the office. You know, we've got a lot of pregnant folks, and we're going to talk about its effect on pregnancy in just a few minutes. But we've got a lot of people in the office setting that have to be there. And if you're having symptoms and you're concerned that you might have this virus, please do not come into our office. You've got two great options. Number one, call the office number, 706-733-4427, and we'll ask you the right questions. Or set up a time to do the virtual visits. And literally, we're going to have times throughout the day Monday through Friday. So we got your back. We're gonna be there for you. So just go to that link and set up that virtual visit, and you can utilize that if you need to get additional information if you're concerned about your particular situation, or if you just need to be seen for something but doesn't require a physical exam. So that's what we're doing for these next 2 weeks in our office. In addition, we now have spots open during Masters Week, which I know a lot of people's things have just gone crazy with all that's gone on with the delay of Masters. But what that's done is kept me in town. So I want to provide the most care and value that I can give during that time. I'm not just going to sit out here and lay in the pollen. So there are virtual visits that are going to be available throughout that week. So go on the link that I'm going to put up there if you're interested. Even if it's just for a consultation. If you're from out of town and you're having a hormone issue, for example, we can do a consultation, or we can do whatever we need to do to meet your needs. That's the bottom line, is we want to provide as much information, as much access, as much care as we can on a regular, ongoing basis. And that being said, because we're limiting our patient population next week to predominantly obstetrical, and we are keeping spots open for GYNs if you're having problems or emergencies. I'm not saying you can't be seen. We're just going to have a separate time frame for you to be seen. But because that's going to free up a lot of my schedule in particular, since I'm the only one in the practice doing GYN, I'm going to use that time to try to put together daily or every other day updates with as much information as I can to keep you informed, so you can cut through the garbage. I mean, think about, this is almost like what happened when the internet exploded, is that people had no way to curate this information. They were getting so much garbage from Google searches and from fake news, is they just were frustrated, as I've been frustrated when I'm looking for non-medical issues, in knowing the accuracy of the information that is out there. So my goal, my purpose is, over these next couple of weeks, is to try to provide succinct, accurate, useful, practical, helpful information that you can use to help guide the decisions that you make over these next couple of weeks. So I'm going to be coming on Facebook Live on our Facebook page, our Women's Health of Augusta Facebook page. I'm going to be doing several on the WOW community, because I've fallen in love with you guys. The feedback, the interaction that has come from this community, you guys are the best. You really are showing your true colors by the impact that you're having on other people in the community. And I really hope we're able to provide a service like no other during this time when we just need accurate information. We just need information that'll keep us from doing crazy things and from being over. We got enough stuff to be stressed about, to be worried about false information. So that's my goal, that's my purpose. So let's get into some of the questions that were asked in when I first posted it, and I'll address those questions. And I'm looking up here on the feed, and I'm seeing Sherry and Connie and Kathy and Geraldine and Sharon and Ginger and Mary Helen and Susan. As we go through this, usually I can catch the feed, so if a question comes up that I'm not addressing, please go ahead and ask it, and I'll see if I can address that along the way. But I want to go ahead and answer the questions that were submitted early on, and there were some great ones, and I actually consolidated several to be able to be as efficient as possible. And I apologize that we're probably going to jump around a little bit, but just bear with me. I think that's going to be the best way to get the greatest amount of information out. So I apologize for a little bit of disorganization in that respect. So one of the first questions, in fact several questions mention this, is if or when someone suspects or is diagnosed with COVID-19, how should they treat the virus? Are there any over-the-counter medicines that'll help with the symptoms? Great question. Well, first of all, let me just update you as of about 5 hours ago, there were 9 confirmed cases in the CSRA. Now, what does that mean? that means there's 648,543 people who have not tested positive. That's the way I think you ought to look at this. Now, that doesn't discount the importance of everything we've been told, the social isolation, the hand washing, you've got to be smart about this. But I also want you to remember that there's still a lot of folks who are doing really well. And that's not, I just want you to keep that in perspective, maybe tamper down the panic level a little bit. So there are 9 cases. That's going to increase. I guarantee you this time next week, we're going to be a lot more than that. That's just the nature of this disease. That's the way it works. But the goal is, and you've all heard about the flattening the curve, the goal is to try to minimize the rapidity of the spread, to spread it out, so to speak, over a time frame so as not to overwhelm the hospitals. And let me tell you, in Augusta area, we are blessed with a multitude of ICU beds, of physicians who are capable of dealing with these issues. We are in a lot better shape than a lot of places we have a tremendous concentration of medical services in a relatively small town comparatively. So we're in a very good place geographically and demographically. So take solace in that we've got, yes, of course we could be overwhelmed next week, but the likelihood compared to places who don't have the resources that we have is much less. So I hope that calms some of the anxieties. So how do you treat it if you've actually tested positive? And we'll talk about testing in a minute, or even if you just are having symptoms, which again, the symptoms that you're looking for are a fever. And what do we call a fever? Well, fever technically is anything over 100.6. Generally, with the COVID virus, we're seeing that those temperatures are going to be more up in the 101 to 103 range. Not with everybody. Some people don't even run a fever, but that's the exception rather than the rule. Shortness of breath, difficulty breathing, a dry, hacky cough. Those are the kind of things you want to be on the lookout for. Now, in Augusta, Georgia, the pollen capital of the universe, everybody this time of year is getting stuffed up. They're getting the allergies. Hopefully by this point, you know your body and you know what's the norm for you. If you're experiencing what you have for the past 25 years, don't freak out and think, oh my gosh, this time it's the coronavirus. Not saying that it's not, but I'm just saying you know your body better than anybody. And if this is the same pattern that you experience this time of year, just monitor the symptoms and see where they go. So if you do have any of these symptoms, then and say you get tested and you test positive. If you don't have any of the high risk factors, and those are things like hypertension, diabetes, elderly, and I really hate this definition of elderly that people are putting out there. They're saying 60 and above. Come on, that's spring chickens. Those folks are just starting, right? There's a difference between chronological age and physiological age. You could be 50 and be functioning physiologically in an 80-year-old if you've got some of these underlying problems. And you can be a 70-year-old and be functioning physiologically as a 50-year-old. So that's what I mean by the age is not that important. It's how your overall health is. So anybody who has these underlying conditions, you've got to be a little extra vigilant because you're at greater risk for contracting complications. Still, the data is showing that 80 to 90% of people who contract this illness have either mild or moderate symptoms. They don't need to be hospitalized. They don't get into the respiratory issues that we hear about with the ventilators. There's a substantial number of people who have these underlying conditions that will require that, but the vast majority of people will not. So if you have these symptoms, what do? You isolate yourself. Again, this is just common sense. You hydrate as best you can. You try to maintain as healthy a diet as you can. We'll talk in a moment about vitamins and supplements that can be utilized. And you really only need to get in touch with your healthcare provider if you start seeing a lot of the more severe respiratory issues like shortness of breath or tingling in your hands or feet, or if you're starting to have problems concentrating because you may be not getting the correct oxygen level, or if your fever gets very high. So for most people who have mild to moderate symptoms, essentially you just treat it like you would have a flu bug. You're not running into the ER or going to the hospital if you have the flu. If it's not that bad, if it's a mild case, you're staying at home, you're getting rest, you're drinking fluids, you're eating healthy, just common sense kind of things. And that's exactly what you need to do for this. In addition, there are some interesting things that I wanted to present to you. There's questions out there about zinc with regards to its use in helping to reduce not getting the virus, but potentially reducing the symptoms. And there's a few studies out there that show that zinc supplementation, either in oral form or a lozenge form, or there is a liquid form, it's harder to find, but that actually might reduce the severity and the duration of the symptoms. We know that's already been shown with certain viruses that cause other respiratory issues like the common cold and even influenza. So using certain zinc preparations might make a difference in the duration and the intensity. Obviously, it's not a treatment if you have severe issues. If you're having breathing difficulties, it's not going to solve the problem. It's like I tell people, if you're standing on the ledge getting ready to jump off, St. John's wort is not going to help your depression. That's an acute situation. Well, the zinc might be helpful and beneficial, but it's not going to cure the issue. A couple of ones I've researched that I really like. One's called Nature's Way Zinc, and I'll put all this in the notes so you don't have to take notes on this. Nature's Way Zinc, it gives you 23 milligrams of elemental zinc, which is great. There's one called Zicam Cold Remedy, which is a very popular one, which many people have already used in the past, and that actually is not bad. That gives you supplemental zinc. What's interesting is most of the studies on these supplements, whether we're going to talk about zinc or vitamin C or vitamin D, largely those are helpful in people who are already deficient in those. And a very important distinction, in most cases, if you already have adequate levels of these micronutrients, adding additional will really not do much for you. It's people who are actually deficient. So why are these important? Why are these supplements important? Well, they enhance the immune system. In most cases, zinc actually has been shown to help decrease viral replication inside the cell. And I don't want to go into the nitty-gritty about that, but just know that there's very little harm in taking zinc. Yes, it can combine with certain medications, and you shouldn't take them together. And no, you shouldn't go out and take mega doses of it, but there's a big cushion of safety. The same thing applies to vitamin C. There's some evidence that using a wide variety of dosages, in most cases what we call super physiological dosages in the range of 3 to 5 grams a day, can reduce symptoms associated with viruses or viral replication. You got to be careful with that high a dose, is that sometimes you can see some GI problems with diarrhea, etc. But that has been shown also. A very interesting study out of China, based on a lot of these cases, they've been using Panax ginseng, which is a form of ginseng. Many people are familiar with the herb ginseng that's called an adaptogen, which means it helps with the immune system. And there's a couple of studies that, again, are similar to zinc that show that the ginseng may help reduce the duration and intensity of some of the mild to moderate symptoms. And again, that's the actual study that I saw was on Panax ginseng, which is the American ginseng, and that was about 1 to 2 grams a day of the extract, or 200 milligrams of what we call the standardized extract, which is what most people are going to run across. Vitamin D has been touted by some individuals to help with immune response. What I think is important about vitamin D is we're seeing so many people actually are deficient in that to start with. If you're not getting outside, not getting a lot of sunshine, if you're elderly, or if you just don't get outside or use a lot of sunscreen, you may actually be deficient in vitamin D. So this is an example of where vitamin D supplementation, in fact vitamin D3, 1,000 to 2,000 a day, can actually get you back to where you need to be. So in that case, you're actually enhancing your immunity. The bottom line with any of these supplements is we want to enhance your own intrinsic immune response. What's the best way to do that? It's a healthy lifestyle. It's the appropriate nutrition. It's the appropriate supplements. It's appropriate sleep. It's the appropriate activity level. Use this time as a wake-up call. Use this time now, this moment we're in now, to say, this is my wake-up call. This is where I need to say, I need to take care of my body. I need to take care of my mind. I need to take care of my spirit. I need to do what I need to do to make sure that in the future, when this happens, and it will happen again, that you will be in optimal health at that point to fight. There's no better prevention than being in good physical, mental, and emotional health. That's your best vaccine against this virus or the next virus. So all that being said, use the immune enhancers like the ginseng, like the vitamin D, like the vitamin C, like the zinc, to see if that would maybe minimize the symptoms, but use that for the future. So I mean, now and in the future, I can't say that enough to stress. You want to get yourself in a good place from here on out, because it's gonna happen. It's gonna happen. I mean, we've already seen MERS, SARS, H1N1. Ebola. I mean, this is going to be a cycle. This one actually is unique because it's a new coronavirus, and we don't have this kind of herd immunity like we would have with a lot of other influenza viruses. We're probably going to have a vaccine, but it's not going to be for this season. So your best tool to fight this off, both now and in the future, is being healthy. And we all know what that means, that balance in mind, body, and spirit. You're going to get me on my high horse here. Get me going. Get me preaching. All right. Next question. Can you get COVID-19 more than once? Great question. There were several people that asked about this. As a nurse, I worry about this, not really getting much info on the topic. Well, the reason you're not getting much info on this is because we don't really know. There's a number of studies that are ongoing, and quite honestly, most of these studies are coming out of China. I hate to say it, but man, is your faith in Chinese studies really high right now? I mean, I hate to denigrate there's a lot of really brilliant people over there, but I'm just not sure I trust a lot coming out from there right now. But that being said, they're looking, because they have the retrospective now. They're 2 months ahead of it than we are. But there's two schools of thought. One is that this indeed is a virus, and like most viruses, we do build up antibodies against that virus in our bloodstream, the little Pac-Men that go around and chew up all the bad stuff. So when we see that same virus again, we go in and chew it up and we're fine. But we don't know if this is going to act just like that kind of virus right now. There is some suspicion, because people are seeing that we are developing that antibody response, that will be the case. But even with other viruses, we know that sometimes that protection is not lifelong. That's why you have to get booster vaccines along the way. But we do know that there's enough similarities that it's very likely, at least in the acute situation, that if you get it, you get exposed, you develop the antibodies, you then get rid of the virus, you're probably going to be protected for a period of time. We just don't know how long yet. Another question, is it safe to walk outside if where you're walking is in an area that there's not really this 6-foot social distancing on the walkways? Let me talk a little bit about social distancing. You know, that 6-foot rule didn't just arbitrarily show up. That's based on a number of studies that illustrate why this virus is transmissible. There are two broad categories for transmitting a virus like this. One is called aerosol, and one is called a droplet. Now, droplet is like when you sneeze and boogers and stuff and all goes all over the place. Those are droplets. They're big things, and they can have a bunch of virus. Aerosol is a very fine mist, and it's it's much more, I mean, you can't really, largely can't see a lot of that because it's more microscopic. Well, this virus is transmitted in both the droplets and the aerosol. So the studies have indicated that when they look at the distance between people, that's the distance that makes the least likelihood of having that aerosol or those droplets get on your person or being breathed in. So that's where that comes from. So to answer your question, probably being outside is the best place you could be because you've got the potential for tremendous dilution of the aerosols. Now, if you're walking with somebody out on the canal and they turn over and sneeze on your shoulder, you're not going to be protected. I mean, if they cough in your face as you're trying to tie your shoe, no, that's not going to be a benefit. But if you're just going out for a morning walk, or you're going out to exercise, or you're out running, chances are you're out riding your bike. Chances are you're actually in a more protected place than if you were in any kind of enclosed area. So I encourage you to continue your exercise, continue your outside activity. If you do it in a group, become a loner. Just tell your group that you're gonna do it on your own. This pollen's getting to me now, but don't stop. So I encourage you to continue that activity level, especially outside. Question says, my mom is 79. She lives alone, but I'm the person who she calls on to help with all her shopping and doing all her home care. She's staying at home until all this passes, but is there anything else that I can do to not carry germs to her? You know, it's a wonderful question, and I think a lot of people are in that scenario, in that situation where you're a caregiver. And there's several things that you can do that will reduce the likelihood. Obviously, if you have any symptoms or if you are exposed to any known carriers, you're just going to have to make other arrangements and call in the cavalry and get some help, because you really don't want to be in close physical contact if you have either symptoms or a history yourself of coming into contact. Short of that, you want to do the smart things. You want to use the hand washing. You want to use the hand sanitizer. Make sure that it's at least 60% or above alcohol. You want to wipe down all the surfaces in the house itself. If there's any question about what your exposure has been, just wear some rubber gloves just to be helpful. If you really want to be super protective, wear a mask. I'm not advocating that, because we're showing that in people who are not symptomatic and haven't been exposed, there's not a whole lot of protection in doing that. But just be smart about your own scenario, and then do the hygienic thing as you're working with whoever you're taking care of. Had several questions related to pregnancy, and I'll just kind of combine them with this. I'm currently 28 weeks pregnant with my first child. How does this virus impact pregnancy and unborn babies? I know pregnancy affects the immune system. Does this put us at higher risk? Great question, and it's one that's probably caused the most anxiety in our office. The studies that we have so far, and I'll admit we don't have a large cohort of people to study, but the studies we have so far show that there's no placental transmission of this virus. In other words, if the mom has it, she's not transferring it across the placenta to the baby. The studies that we've had so far show that the amniotic fluid, the placenta, the cord blood, all that shows up negative from the virus. So at this point, there's no evidence of any kind of birth defect cause or anything like we see with other viruses like rubeola or German measles. Yes, indeed, a woman's immune system is, I won't say it's more challenged in pregnancy. So the place that we're careful is with our history with influenza. There is a small percentage of pregnant women who get the flu who have serious complications from that. A very small percentage. Because who are the pregnant folks? They're young, they're usually in good health. So the likelihood of them developing complications is minimal. There are some anecdotal evidence that there might be incidences of preterm contractions secondary to people infected with coronavirus, but in general, pregnant women are not at any greater risk other than what we would attribute to any viral illness than anyone else. So you need to use the same precautions, but don't be concerned at this stage. And data can change, but at this stage, don't be concerned about any harm coming to the baby from the pregnancy. Several questions were asking about where to get tested, and I think it's important to understand there's kind of an algorithm that you want to go through. Not everybody needs testing. I think as we progress right now, there's still problems with the testing, not the kits, but what we call the reagents. This is a very complex test. There are largely two tests. One is what we'll call a rapid test. And you may read on certain websites or hear on the news people talk about a presumptive positive. Well, a presumptive positive is someone who's had a local test. Maybe a local lab has developed a test and it comes back positive. Then they have to send that to the CDC for the FDA approved test, and that usually takes, they can get the presumptive test back in literally hours, and the CDC test may take 24, 48, 72 hours. So the problem is not the testing, it's the reagents, because it's a very complex test that is time consuming. They're really, with Lab and LabCorp and Quest, they're beginning to automate this, so the testing is going to be much more available in April. But generally the only people that need to get tested are people who are known exposures, people who've been in high-risk areas, who are experiencing symptoms, especially if they have any of these comorbidities, the diabetes, the hypertension, the lung disease, elderly, anybody at risk. I know that AU is having they have a website, and I'll actually put that website on the page here, that will walk you through the triage process to see if you're someone who needs to be tested. I know that Augusta or University Hospital has a hotline, and I'll put that number also where you can call and they can ask you about your symptoms. In fact, that's a perfect use for the telemedicine for us, is we're happy to screen your symptoms and let you know if you need to be tested or not. AU has a testing center over at their drive-through clinic at their field house over off Wrightsboro Road. I know University Hospital Prompt Cares, obviously the ERs, but University Hospital Prompt Cares have testing facilities, and probably in the near future we're going to get, you heard about Walmart and CVS, they're going to be doing some testing. I'm not quite sure. I couldn't find if that was actually available. If somebody knows that, locally, put it on the stream here. But hopefully we're going to know. But you can get it over at the AU Christenberry Center, the sports complex off Wrightsboro Road, or at the University Prompt Cares. But they ask you to call there first, and they ask you to go through that triage first. But we're happy to do that for you, either by phone or by our telemedicine if you're concerned about getting tested. A couple of things that I think that are really important. There's a lot of studies that are ongoing. You hear talk about vaccines. There's a tremendous push right now for developing a vaccine for this virus. And everything that I've read in the last few days indicates that we will have a vaccine, but chances are it's not going to be available for this particular outbreak. And that's okay, because we're still not sure if this is just a seasonal virus or if this is just the first episode. We know that influenza is seasonal. We know that there's something to do about the heat and the moisture and the humidity that decreases the spread. We don't know that yet about COVID-19, but we probably will see a vaccine. And I don't want to go into specifics about the difficulty in creating a vaccine, but there's tremendous importance in making sure it's safe, and that takes time. You have to see the impact of a vaccine over time, because you're not giving somebody something to treat an already existing problem. You're giving something as a prevention, and that raises the bar for safety. You absolutely have to know that you're not causing harm. First, do no harm. So that only can be shown in most cases with a time scale, so you can assess the changes that occur. We've all been bitten by doing something on the spur of the moment and regretting later because of unintended consequences or just unknown consequences. But I can promise you there's tremendous resources being put into developing this vaccine. Again, I mentioned there's some very important things that each of you can do. The hand hygiene is probably the most important. There's some great videos online now about finding your favorite song to give you that 20 or 40 second wash. So have a good time with that. I probably wash my hands more in the last 2 weeks than I will for the rest of my life, but it's a good habit to get into. Use the hand sanitizer. Make sure that it's at least 60% or more ethyl alcohol. It'll say it on the label. Some interesting developments in drugs used to treat the coronavirus. In particular, one called remdesivir that's initially was used to treat Ebola. There is some real positive things that are turning up with people who, obviously these are people who are having severe issues with the use of this IV antiviral medication. That's ongoing and will be ongoing, but the results so far are quite positive. There's studies looking at taking antibodies of people who have recovered and using those. Remember, those are the little Pac-Men that chew up the bad things in your bloodstream. Taking those from people who have recovered and infusing those into people who are ill, and they're seeing some positive impact there. There's tremendous resources that are going. I sound like Trump. There's tremendous resources going into this. There are a couple of drugs that are used to treat HIV that are being looked at. As you know, HIV is a virus also, so there's some commonalities in how these things are being evaluated. One called lopinavir and ritonavir. There's a couple of interesting studies looking at the combination of Plaquenil and Z-Pak or Zithromax, an antibiotic that many people take for upper respiratory. Now, please do not go out and start taking a Z-Pak thinking that's going to help fight this off. That's an antibacterial. This is a virus. Apples and oranges. I'm just saying that there are a couple of studies that are looking at this to prevent secondary pneumonias. So all this being said, I don't want to get into the bushes too much with the treatment protocols. All this being said is that there's tremendous work being done. We're seeing already positive results, and I think we're going to continue seeing that over the next weeks to months. There was a question about the use of ibuprofen and other non-steroidals with regards to the symptoms of COVID. If you develop the flu-like symptoms, should you use a non-steroidal or ibuprofen? And there's mixed data on that. Most of the people who were coming out talking about not using Motrin or not using non-steroidals were basing it on studies that showed rare complications of people taking those who were suffering other viral problems. So it's not necessarily specific to the COVID-19. They're analogizing or making the jump, the leap, that it's possible that if people develop this Stevens-Johnson syndrome or this Rye syndrome from taking these non-steroidals when they had influenza, that they possibly could also develop that with coronavirus. And it's possible. Really, the bottom line is, if there's any question, just take Tylenol. Now, I will tell you that the World Health Organization actually came out with a statement today that said that there is not any information, any data that says you should avoid the ibuprofen. So that actually came out just this afternoon from the World Health Organization. So if there's any question, take Tylenol. If Motrin works better for you, I feel very comfortable based on what we're seeing in utilizing that for the relief of symptoms. As I mentioned, there were to date 9 cases here in the Richmond County area, largely concentrated with people who are associated with Augusta University. Many, one's a pediatric resident. There's several others who are staff members there. So we want to look on the positive, and here's a couple of data points that you don't hear about too much. Tuesday, there were 81 tests that were performed locally. 42 of those were negative, 52 are pending. Monday, there were 64 tests, 33 were negative and 3 were positive, and 30 were pending. And by pending, I mean these were the ones that were sent to the CDC and we'll probably know. But we're seeing a fairly high rate of negatives. And remember, these are in people who are already symptomatic. So that's encouraging from that standpoint. We are seeing a number of places that are doing some really good stuff. They're using this opportunity of self-isolation, downtime, to try to find the positive. One of the things I ran across was several of the fitness clubs were starting to film online videos to help people where they can just watch them online to exercise at home so they can still maintain their activity level. Several of them are doing this free. One called One Planet Fitness, 305 Fitness. There's one called Down Dog, which I love. It's obviously a yoga site, and they're offering free yoga classes online to anybody during these couple of months. And again, I'll put all this stuff out there so you can access it later. One called CorePower Yoga, one called Simple Habit. These are all, to me, what this means is these are people who are saying, yeah, this sucks. This is a horrible situation. It's transforming the lives of many of us right now. But we're going to take that and we're going to transform that into something positive. We're going to meet a need. We realize that people still want to exercise. People still want to be active. So we're going to provide that means. I love this attitude, and we're seeing it over and over again. People are saying, okay, here's the situation. We can't do anything about the situation other than what we need to do to keep everybody safe. But how can we think about what needs are not being met, whether it's somebody who needs supplies or somebody who needs, my daughter did a story the other day on a lady who was reading children's books that you could access so kids would have something to listen to besides playing some of these games. So it's just being creative and saying, what can I do to turn this bad situation into a positive that'll make me utilize my time in a fashion that's more positive and effective, and it'll help you and probably a lot of other folks. And that's what I hope to do over these next couple of weeks, is use this time to provide as much useful content as I can. And I depend on you for some of that, because I get an idea of some of the questions that come up, but I really want to know what's on your mind. I want to know what questions you have, and that'll help direct me towards the information that I want to put out. Let's see, Tammy says, I had to sign for a package today. I thought about it after the fact. How many people have used the same pen to sign it? That's an interesting question. The question came up, well, am I going to get this from my mail? Am I going to get this from packages? Well, there's a lot of studies looking at what we call fomite transmission, and that's just a fancy name of saying, does something I touch transmit this virus? The data so far is showing that something like cardboard, for example, which most packages are, potentially could harbor the virus from 12 to 24 hours. Now, again, the likelihood with what all goes on in the transportation and the fact that from the time it leaves to the time it gets to you is past that time frame, the likelihood is very small that you would actually get enough viral load from opening that package or opening that mail, unless obviously your mail carrier is sneezing all over your packages, which we hope at this point people have enough common sense not to do that. But if you really want to be careful, sure, wear gloves when you open the package, clean it off with a Clorox clean, do the same thing with your mail. They have the aerosol hand sanitizers that you can use, but just use gloves if you need to. But the transmission is much higher on steel surfaces, for example, again, 12 to 24 hours. That's why you see places where people are being wiped down literally every hour with the Clorox cleanups and all the different antiseptics. Plastics can transmit it. One of the concerns is that, yes, this is showing up to be a little bit longer lived than certain viruses, but it's not like it's staying on a surface for 5 days, and they're very susceptible to the antiseptics that we're using to clean. So I think, again, being very thorough and being very careful will help flatten this curve. Yeah, this is a quote from the Surgeon General that actually said that a delivery recipient can reduce the risk of transmission by good hand washing, using the hand sanitizer. If you want to lose gloves, gee, he's saying the same thing I did. Thank you, Surgeon General. All right. Again, let me put out this phone number. This is the university hotline. If you have a question about triage or what you should do, you can call 706-828-2477. You can call our office, or you can request a telemedicine visit, and we will assess your symptoms and give you some direction. Note that that's out there and available. All right, guys, that's a lot of what I wanted to cover. I really appreciate it. I see a lot of you have stuck by. I greatly appreciate. Whoop, I touched my face. I'm not supposed to do that. Sorry about that. I'll wipe that way. Really, the bottom line is this. This will pass. It's going to transform a lot of how we live, just as 9/11 did. If you remember what it was like when we flew in planes pre-9/11 and what we've done since 9/11. So it's going to change a lot of things. It's going to change how medicine is delivered. It's going to change our preparedness. It's going to change our public health policy. It's going to change our economics. We probably have no clue yet as to how much it's going to change. But the only thing that I can predict with 100% certainty is it's going to change. And the key is not how it changes, it's how we respond to that and how we use that to identify things that we can do as individuals to make sure that that change doesn't hurt others, and make sure that first and foremost ourselves and our families are taken care of, and that those around us, whether it's economic hardship or whether it's medical hardship or a lot of the domino effects that result from that, that we utilize this time to be better people than we were before. If we can come out of this and we can look at ourselves and say, I'm a better person than I was, then there's going to be some positive to be gained from all this. It's going to be a struggle. These next 2, 3, 4 weeks are going to be different than any of us have lived through. You know, I'm no spring chicken, and I've not been through a world war, but I've been through a lot of things and understand that this is new and unique. Each time is a challenge. But if we look at it from the standpoint of what I can do to make the world a little bit better in my little corner of it, if we have that attitude, that belief, and again, look towards taking care of yourself, taking care of your family, and then exploring ways to take care of everyone else that's your extended family. You know, as Jesus says, look towards your neighbor. Well, who's your neighbor? Well, it's everybody. I mean, that's the bottom line. If we look out for each other, we're going to get through this together. And it's going to be difficult, it's going to be hard, but if we keep that attitude and we take care of each other and we take care of those who are going to be hurt the most by it, and there's going to be a lot of people, not just medically, but but emotionally and economically, and if we look out for their needs, we're going to end up in a better place. We're going to look back 6 months, a year from now, and say, I'm a better person. And maybe, just maybe, our little part of the world is going to be a little bit better place. So with that, I want everyone to not panic, to be smart, and above all, make healthy choices. We'll see you
real soon.